Hey everyone, and welcome to This Explainer. I am absolutely thrilled you're here today because we're tackling a topic that, let's just be totally honest for a second, can bring up a ton of anxiety for people. We're talking about STD testing. Look, whether you've noticed something that just doesn't feel quite right, maybe a partner recently tested positive, or, perhaps you're simply being proactive about your sexual health, it is completely normal to feel a little stressed out about it. But today, we're going to strip all of that anxiety and stigma right away. We are going to give you a clear, straightforward, and completely stigma-free guide to taking control of your health.
So here's our quick roadmap for today. We'll start by talking about the silent epidemic, then cover the types of STD tests, timing and accuracy and speed, privacy and costs. Finally, we'll look at testing locally at Mederi Urgent Care in Los Angeles.
All right, let's dive into Section 1, the silent epidemic. Okay, we really need to completely reframe how we think about STDs and just ditch the stigma entirely. Seriously, forget the embarrassment. We need to start looking at this as a highly common, widespread health issue that affects literally millions of people from all walks of life. According to the CDC, there are nearly 26 million new sexually transmitted infections that occur every single year in the United States alone. 26 million! I mean, when you hear a number that massive, you realize incredibly quickly that STDs are not some rare anomaly. They're just a routine part of human biology and modern life.
To put that into perspective, that 26 million translates to roughly 1 in 5 people in the U.S. having a sexually transmitted infection at any given time. That's 20% of the population. But here is the really critical part, and it's kind of wild. Most people just assume STDs always come with obvious symptoms, like sores or pain. But the reality, many common infections like chlamydia, gonorrhea, and even HIV can be completely silent. Like they can be present for months or even years without producing a single noticeable sign. And that right there is exactly why we call it a silent epidemic.
I really love this because it just hits the nail on the head. Testing is not optional. It is part of basic healthcare. If you're sexually active, especially with new or multiple partners, getting tested is absolutely not a punishment for bad behavior. Untreated STDs can lead to some really serious complications down the road, like pelvic inflammatory disease or even certain cancers. Routine testing is simply basic maintenance, guys. It's truly one of the most responsible things you can do for yourself and for your partners.
Moving right along to Section 2, types of STD tests.
So one of the biggest reasons people actually avoid clinics is just the fear of the unknown, right? Specifically, what exactly are they going to do to me in that room? Well, let's demystify the whole shebang right now. If you have a fear of needles, I've got some great news for you. Non-invasive tests are actually the standard for some of the most common infections. Urine tests are the super simple go-to method for detecting chlamydia and gonorrhea. Swab tests, which can be taken from the throat or other specific sites, are fantastic for catching infections that a standard urine test might actually miss. Now, of course, blood tests are still used to look for antibodies for things like HIV, syphilis, herpes, and hepatitis. But as we'll talk about more in a bit, there are even rapid tests available now that use just a tiny little finger prick to get you HIV and syphilis results in as little as 15 to 30 minutes.
Okay, Section 3, timing and accuracy.
So it's one thing to get a test, but getting it at the right time so you can actually trust the results, that is absolutely crucial. Let's look at the science for a second. When performed correctly, modern STD testing is overwhelmingly accurate. Now, you might hear medical jargon thrown around, like nucleic acid amplification tests, or NEATs. Please don't let the complex name intimidate you. Literally, all that means is that the lab tests for chlamydia and gonorrhea have sensitivity rates well above 95%. And those fourth-generation HIV tests, they have accuracy rates exceeding 99%. The science is incredibly reliable.
But there is a catch here, and it's called the window period. And no, window periods aren't just for house hunting. In medicine, a window period is the time between when you're actually exposed to an infection and when a test can reliably detect it in your body. If you test way too early, before that window period is over, you might get a false negative.
Think of this timeline like your personal calendar to help you figure out exactly when to walk into a clinic. For chlamydia and gonorrhea, the window is actually quite short. They become detectable just 1 to 2 weeks after exposure. HIV tests are most reliable 2 to 6 weeks out. Syphilis usually takes about 3 to 6 weeks to show up on a blood test, and herpes antibodies typically appear anywhere from 2 to 12 weeks after infection. Timing really is everything for your peace of mind.
All right, Section 4, speed, privacy, and costs.
So we've covered the science, but let's be real for a second. The biggest barriers keeping people out of clinics aren't usually scientific, they're logistical. People are understandably worried about money, their time,
and their personal business getting out. So let's just ask the most common anxiety-inducing question out loud right now. What did STD testing actually cost?
Well, if you go to an emergency room for STT testing, you could be looking at a bill ranging from $500 to well over $1,500. No way, right? But an urgent care clinic, they provide the exact same tests for a fraction of the price, generally ranging from about $50 to $250 out of pocket, totally depending on what tests are ordered. And here's an even better fact for you. Most private insurance plans, Medicaid, and preventative screenings under the Affordable Care Act actually cover STD testing with absolutely zero out-of-pocket cost to you.
Now, what about privacy? If you get tested, is your employer going to know? Is your family going to find out? Under HIPAA, which is federal law, your healthcare provider is legally required to protect your medical information. Confidential testing means your name is attached to your results at the clinic, sure, but those results are securely locked between you and your doctor. They literally cannot be shared with anyone without your express written consent, period.
Which brings us to our final section, Section 5, Testing Locally at Mederi. So we know the what, the why, and the how much. For those of you checking out this explainer from the Los Angeles area, let's talk about the where. Mederi Urgent Care provides the ultimate local solution, and they make the process incredibly simple. It's essentially just a non-scary 15 to 30-minute checklist. Step 1, you check in. Step 2, you have a completely private consult with a medical provider to discuss any of your concerns. Step 3, you provide a sample, blood, urine, or swab. And Step 4, you get your results and a treatment plan. Remember earlier when we talked about untreated STDs? Well, if a test does come back positive, many STDs like chlamydia and gonorrhea are easily curable with antibiotics right there at the clinic.
Let's just fire through some of the most common FAQs we hear about testing at places like Mederi. First, and this is a real game changer, in California, minors aged 12 and older can legally consent to STD testing and treatment without parental notification. That empowers young people to seek care safely. Second, if you use insurance, your explanation of benefits is only going to show general services. It will never, ever list specific STD test results. Third, as most patients will tell you, the experience is fast and minimally uncomfortable. And finally, Mederi offers those rapid HIV and syphilis tests we mentioned earlier, giving you results in just 15 to 30 minutes before you even walk out the door.
So, here is your concrete call to action if you are in LA. Mederi Urgent Care has 4 super convenient walk-in clinics located in Hollywood, Glendale, Los Feliz, and West LA. They're open 7 days a week from 9 a.m. to 9 p.m. And honestly, the best part? No appointment is necessary. You don't have to rearrange your entire work schedule or wait weeks to see a primary care doctor. You can literally just walk in today.
Which basically brings us to the end of our explainer, and I want to leave you with this final kind of provocative thought. We've looked at the data together, we've seen exactly how common these silent infections are, and we've seen that modern clinics have entirely removed the usual barriers of high costs, privacy concerns, and long wait times. Getting tested is quite simply the easiest, most responsible decision you can possibly make for yourself and for your partners. So, with all those barriers gone, what is holding you back from taking control of your sexual health today? Thank you so much for hanging out with me to walk through all this information, and I really hope this empowers you to take that next step.